Hello everyone, very good morning. So we were discussing your community health nursing unit 1. So we have seen determinants, we have seen what are the health indicator, we have seen what is the concept and we have seen the definitions. And in this class I would like to discuss you regarding the history and development of this community health nursing and its present concept. So in yesterday's class, we have seen the history and development of community till 1946, means before the independence. And in today's class, I would like to discuss you the development that has occurred in the field of community health nursing after the independence in our country, India. Coming to the post-independence era. So till now, we are in the hands of the Britishers. From the year 1755 to the year 1947, British people were ruling us. But in the year 1947, India became independent and a democratic regime was set up with a new concept which is aimed to the establishment of new welfare state. So here if you see the national government, it took the responsibility mainly to improve the health of the people, and they have mainly taken the guidance of the Boer committee. So based on the recommendations that were made by the Boer committee, they have created lots of planning and they have also created the steps which were adapted in the coming years. And in the year 1947, the ministers of health were established both for the central as well as state government. So as a result of that, now we are having the health minister for each and every state, and also we have a health minister in the central government level. And here if you see the post of Director General for the health services, it was created, and the Director General, he is the chief advisor to the union government on medical as well as public health matters. So whatever the problem that is going on, the Director General, he is the person who always gives you the report. And in many states, if you see the posts of general surgeon or inspector general of hospitals and the directorate of public health, they were integrated into the post of director of health services. So this was the thing that happened in the post independent era. And if you see in the year 1918, so all these things were happening in the post independent era, means mainly after the independence. So India became the member of World Health Organization. So here employees state insurance act was passed in the same year 1918. So here mainly the employees are getting beneficial with this employees state insurance act. So this one is called as ESIC. And also during this year, the report of environment hygiene committee, it was published. And if you see in the year 1949, so here the Constitution of India, it adopted by the Constituent Assembly, and all the health subjects, they were enumerated. They have been enumerated under the three lists: union list, concurrent list and state list. And coming to the 1950, here planning commission was set up by the government of India, and during this only we have this first 5-year plan. So this one is called as central food. And in the year 1951, here this years are the first beginning of 5-year plan. So the first 5-year plan, it was mentioned or it was established in the year 1950, and it came into existence from the year 1951. So here BCG vaccination program was launched and Central Drug Research Institute was opened at Lucknow. And also in the year 1952, if you see the Community Development Program, it was launched on October 2nd, 1952, mainly to focus the overall development of rural areas, not to pertain to a particular place. Mainly they are going for decentralization here. And also a virus research center, it was introduced at Pune with the help of ICMR, Indian Council of Medical Research, as well as the Rockefeller Foundation. So here the Rockefeller Foundation, it is playing a crucial role. It has established a virus research center. Previously it has established a hygiene center, and also it has established a rural training center previously, but now it has established again a virus research center, mainly joint help with the ICMR as well as Rockefeller Foundation. And Indian Cancer Research Center was inaugurated at Bombay. And in the year 1953, mainly a new committee was appointed, mainly to give a draft model on Public Health Act. So National Malarial Control Program was initiated in the year 1953, and National Extension Service Program, it was started nationwide, and Family Program was also begun in the year 1953, and Family Planning Research and Program Committee was also set up in the year 1953. And coming to the year 1954, here If you see, the contributory health services schemes were initiated in the Delhi, and central social welfare board was sought up here, and national water supply and sanitation scheme was launched in the year 1954, and also in the same year they have also launched the national leprosy control program, and the VDRL antigen production was set up in Calcutta, and food adulteration was passed by the Parliament of India in the year 1954. So in the year 1956, the second 5-year plan was begun. The first 5-year plan was from 1951 to 1955, and in the year 1956, the second 5-year plan was begun. The Model Public Health Act was published, and the Central Health Education Bureau, it was established in the Union Health Ministry, and Director and Family Planning was appointed in the Union Health Ministry, and the Demographic Training and Research Center was established in Bombay, as well as Tuberculosis Chemotherapy Center was established in Madras. All these things were happening in the second 5-year plan during the year 1956, and also the Immoral Traffic Act was passed by the Parliament, and the trachoma control pilot program was also launched in the same year 1956. Coming to the 1957, here we also had this influenza pandemic, and it has swept the country. So India faced a great disaster. This is one of the great disaster which has occurred in India, means biologically this is related to the disease. So the here after this influenza pandemic, the demographic research centers were established in the Calcutta, Delhi, as well as Trivandrum. And also in the year 1958, the National Malaria Control Program, it has, if you see the National Malaria Control Program, it was launched in the year 1953, and in the year 1958 it was renamed as National Malarial Eradication Program, and National Tuberculosis Sample Survey was conducted in the same year. And in the year 1959, Mudailar Committee was appointed mainly to see what is the progress that was made in the field of health and science, mainly after the submission of Boer Committee recommendations. So they have submitted the Boer Committee recommendations, and they followed the Boer Committee recommendations, and in order to evaluate to what extent the health services that were provided to the community are satisfying, they have again created another committee which is called as Mudailar Committee. So here if you see, Rajasthan, it was the first state to introduce the Panchayat Raj system, and the National Tuberculosis Institute (NTI), it was established in Bangalore, and nutritional research laboratories were established in Kurnool, and later they were shifted to the Hyderabad. And if you see the year 1960, here School Health Committee was formed, and pilot projects in relation to smallpox eradication program were initiated here. And then if you see the year 1961, the third 5-year plan was started. So the second 5-year plan was from 1956 to 1960, and in the year 1961, the third 5-year plan was started. In the third 5-year plan only, this Mudailar Committee report was published, and Central Bureau of Health Intelligence was also established. And in the year 1962, here Central Family Planning Institution was established in Delhi, and National Smallpox Eradication Program, National Goiter Control Program, National School Health Program, and District Tuberculosis Program were established in the year 1960. So this was history, right? I need to read like this only. I cannot explain. So please cooperate and try to understand. And coming to the year 1963. So here in the year 1963, they have started a nutritional program, applied nutritional program, and National Institute for these communicable diseases were established in Delhi. This one is called as NICD, and National Trachoma Control Program was begun in the same year. National Contributory Health Services Scheme was changed to Central Government Health Scheme, and Extended Family Planning Program was launched in the same year 1963, and emphasis in family planning was shifted from clinical approach to extension approach. Coming to the year 1964. So if you see the year 1964 here, they have introduced National Institute for Health Administration and Education. So it was mainly established in Delhi. The Union government set up the committee under the chairmanship of Shantilal Shah to study the issues of legalizing the abortions. And in the year 1965, IUCD was introduced and direct BCG vaccination program without tuberculin test was introduced, and reinforced extended family planning was launched in the year 1966, and Ministry of Family Planning was appointed under the Ministry of Health, and a separate department for the family planning was constituted in the Union Ministry of Health, mainly to coordinate the family planning program at the center as well as at the states. So if you see, in the same year, in the 1966, they have begun the population council policy. So here international postpartum family program was started. So it was started nearly in 15 countries and in 25 hospitals, and here the two of these hospitals that they have started were established in India at Delhi as well as Trivandrum. And in the year 1967, the small family norm committee was set up. It is mainly set up to recommend suitable incentives to those who are accepting the small family norms and participating in the family planning. And in the year 1968, medical education committee was appointed mainly by the government of India to study all aspects of medical education in the light of needs and resources. And also the small family norm committee report was submitted in the year 1968. In the 1967, they have set up the small family norm committee, and in the year 1968, they have given us the report. And in the same year, they have passed a bill. So the bill was regarding the registration of births and deaths. So this was mainly passed in the parliament, and it was legalized in the year 1968. And in the year 1969, fourth five-year plan was launched. The registration of birth and death was promulgated. The name of the Nutritional Research Laboratories was changed into National Institute of Nutrition. And comprehensive legislation for this control of river water pollution and domestic and industrial waste are drafted, and they were introduced into the parliament. And the report of medical education committee, which was established in the year 1968, was submitted here in the fourth five-year plan. So with this, I would like to end the session here. Thank you so much for watching. Please watch for the other session also to see the history. So the history is very broad. Once the history is finished, we'll get into the topic. So the topic will be very nice. Thank you so much for watching. If you like the content, please like, share and subscribe the channel. If you have any type of queries, please drop them in the comment box. Thank you.